Subscribe to our YouTube channel and don't forget to press the bell icon to get all the latest updates.
Maharashtra and in particularly Mumbai has been the worst hit in this country by the coronavirus disease. In past 3 months, this city has been nothing less than chaotic. Shortages of bed, dead bodies lying in the general wards, high pricing by private hospitals, and the underplaying of the COVID deaths. There have been a lot of questions with no answers. But today we have Aditya Thackeray with us, who will talk to us on these issues. Aditya, after 3 months of a fight with COVID, where do you see Mumbai now?
Mumbai is fighting still. One cannot say the fight is over, and nowhere in the world has the fight got over. But we are battling it hard, we are battling it very successfully. All the medical staff, our nurses, our doctors, they're doing everything they should be doing, they can be doing. Everyone's fighting against COVID.
We have got control over the virus right now, but still Maharashtra or Mumbai leads in terms of numbers. So what are the areas of focus for you right now?
I don't think you should look at the numbers anymore, because honestly a number isn't the rate of infection. You might have more infection in some states but lesser numbers. What numbers really means is the success of our medical officers and our municipal officers to go and see how many people we've actually isolated, and we've been quite successful at that. Our focus right now is to save as many lives as possible, remove the fear, remove the stigma, and yet be careful. I think that should be our focus.
Okay, so now we've got excellent results from Worli, Dharavi. Do you think in a fight in chasing the virus in slum pockets like Dharavi and Worli, we have neglected the other parts of the city like M East Ward, like Govandi, Shivaji Nagar, where there is a sudden sprout in numbers?
Not really. I mean, you can't say neglected, because if you see the figures world over, you can't say that for a city like New York or a city like Moscow or Sao Paulo. What happens is, when the virus transmission happens, it's such a small virus and nobody has been able to tackle it till today. It's moving from one place to another. We're chasing the virus, we're going aggressively door to door and screening people. As much as we can, we will be doing that.
Okay. We have come up with makeshift hospitals like NSCI, BKC and all that. Okay, all these years, for a long time, BMC is governed by Shiv Sena. Do you think we've neglected the medical infrastructure for so long?
Like I said, if you see the numbers of New York or any other city, I don't think the Shiv Sena has been ruling there, so we've not been able to neglect the medical facilities there. Likewise, again, like I said, it's a pandemic. And anyone believing that anyone can neglect a healthcare facility and the pandemic can spread is, I think, ignorant at heart. One should read more about a pandemic or an epidemic and then start believing such.
But don't you think if our hospitals were so equipped for handling the situation right now?
Which city in the world has been able to do that?
Yes, but I think जिस तरीके हमारे city hospitals की हालत है या
ऐसे नहीं है. आप डॉक्टर से पूछे तो numbers जो हमारे हैं, even today, we're still in good control.
Okay.
So before we make any aspersion on any city hospital, any doctors, I think we should realize what a pandemic is and what the scale of it is.
Okay. Now there was a controversy on underplaying the death numbers, the COVID death numbers. उसके बारे में क्या कहना?
I think we are the most transparent state. The fact that we have reconciled data and data cleaning will keep happening every single week. We don't want to hide a single fact or a figure, because this is not something for the present time. What doctor is doing here, what I am doing here, or maybe our recovery number, maybe death number, whatever it is. It's a documentation for future generations to learn, just in case there's a pandemic, God forbid, anytime ahead in future. So we cannot afford to hide a single number. Every fact and figure has to come out, and then we can work on it.
But don't you think suspected COVID deaths were not being recorded or being missed out anywhere? There was not
We've actually reconciled our data. Speaks a lot about the fact that we are being transparent, accountable, and we hold transparency as sacred as it can be.
Okay, the private hospitals have not contributed that much to this fight against the pandemic.
Again, I wouldn't say anything about that, because every doctor, be it a private hospital, be it a private clinic or government, is doing their best. All of us are scared today while working with COVID. Having said that, everyone's giving it their best, and I don't think we should accuse anyone of not doing their best, because everyone's doing their best in their own capacity.
Yes, but you have capped the prices now, but there are still complaints across the city where overpricing is done.
These are administrative issues. Wherever we can, we are dealing with it. But again, to say that someone's not contributed would be wrong, would be undermining their efforts.
So that was Aditya Thackeray for you, the ever positive Aditya Thackeray, who says that Mumbai has finally got a grip over the deadly coronavirus. and the situation in the city overall are improving. And as for the unlock phase 2, it's still a wait and watch situation. With Shiva Devnath, this is Nazia Sayed for Mojo News, Mumbai.